Hi, my name is Escolar. I'm from the Catholic University, and I will talk about a phase of the triad of the seven phase alpha in the lysosomal acid-phase deficit. First, the definition. A lysosomal acid-phase is an essential lipid metabolite enzyme that breaks down amino-cytosis lipid particles and regulates the lipid metabolism. We conduct a phase 3 trial of the enzyme replacement therapy in children and adults with lysosomal acid-phase deficit, and under appraise the case of perseveration and severe dyslipidemia.
Yeah, so recently there's been a lot of discussion about a new condition. It's actually an old condition that we've kind of resurfaced. It's called LAL deficiency, or lysosomal acid lipase deficiency. So what is it? It's a condition in which the liver can't process cholesterol esters correctly. So either because of the food that we ingest that has cholesterol, or as a consequence of the body recycling cholesterol, it comes back to the liver as cholesterol esters. Those esters have to be broken down into free cholesterol for the body to use it once again. And therein lies the problem. They don't have a digestive enzyme within those lysosomes in order to do so. As a consequence, two things happen. One is the cholesterol levels will go up. Again, in most of our experiences, that looks like it might be familial hypercholesterolemia, so our inclination is to treat these with standard drug therapy, including statins. The problem is that cholesterol ester is trapped inside lysosomes, and those lysosomes reside in the liver. And as a consequence of all this cholesterol ester, that cholesterol ester is going to cause damage to the liver, and ultimately it's going to cause scarring or cirrhosis. So these people get into serious trouble with liver failure. Interesting enough, the therapy that we offer to lower cholesterol, statins, may actually make that condition worse, because what they do is upregulate the LDL receptor, cause more cholesterol esters to be incorporated into the liver, but they can't go anywhere. They don't have an enzyme to digest it. So there's new and promising therapies on the horizon. We hope that that'll be FDA approved sometime in the near future and it'll be safe and effective, but it basically is replacing the enzyme that's deficient. And as a consequence of that, hopefully the liver function studies will normalize. Short-term studies up to a year, we've seen dramatic improvements in liver function studies as well as the cholesterol level. So stay tuned. I think lysosomal acid lipase deficiency may be something on everybody's horizon here in the near future.
In this multi-center randomized double-blind placebo-controlled study involving 66 patients, with evaluating the safety and the efficacy of the enzyme replacement therapy acid-lipase alpha. The placebo-controlled phase of the study was 20 weeks long, as followed by open-label treatment for all the patients. The primary endpoint was normalization of the animal's aminotransferase levels. The secondary endpoints included the additional disease-related efficacy, assessment, safety, and side effect profile.
My name is Mark Goldberg. I'm the Executive Vice President for Medical and Regulatory Strategy at Synergy Biopharma. We're studying lysosomal acid lipase deficiency, which is an autosomal recessive disease due to mutations in both alleles of the gene that encodes lysosomal acid lipase. This enzyme is critical in cholesterol metabolism. When an LDL particle binds to the LDL receptor and gets taken up by the cell, the cholesterol esters and the triglycerides within the particle are hydrolyzed within the lysosome into free cholesterol and free fatty acids. And when this enzyme is deficient or absent, there is a dramatic increase in the amount of lipids that accumulate in the lysosomes of the cells throughout the body, but particular in cells of monocyte macrophage lineage and hepatocytes. This leads to progressive accumulation of fat and steatosis in the liver, usually a microvesicular steatosis, so that progresses to fibrosis and cirrhosis. And
The breath. A total of the 65 of the 66 patients were put underwent the randomizations completely, the double-blind portion of the trial and continued with the open-label treatment. At the 20 weeks, the alanine aminotransferase level was normal in the level of 36 patients with a significance alpha group and two of 30 in the placebo group, with mean change from the baseline of the 68 units per liter.
The most difficult part of that year was just not knowing. The stress of test after test and just not knowing what was wrong with him. We did a liver biopsy, and that's when we found out he had stage 2 scarring on his liver already at 5 years old. The day we found out Tristan had this, it was a whirlwind of emotions. I was devastated, my little guy has a problem, what can I do to help Tristan? It was just, if I could change places with him, I would do it in a heartbeat so he wouldn't have to go through it. To find out that there was a trial to help him, it made everything better. It just kind of helped us cope with it. We just told the doctor we just want to do it. Whatever we can do to help him get better, we want to be a part of it. Since Tristan's been in a clinical trial, his lab results are great. Life like today with Tristan is like any other day. He's a normal 9-year-old kid who just wants to run and play. And he really doesn't let it hold him back. He just goes and plays, and he lets everybody know what's wrong so they know to take it easy on certain things. But other than that, he doesn't let it affect his life. For Tristan, the future, I hope he continues on with help raising awareness and helping other people with the disease.
With the perspective of the effective case secondary episode and endpoints, reduction improvement in the lipid levels and reductions in the pedophiles count. The number of the patients with adverse events were similar in the two groups. Most events were male, were considered by the investigator to be unrelated to the treatment.
We've got two presentations and a poster at the meeting. The first presentation is the results from a phase 3 study, which is a double-blind placebo-controlled study in both children and adults with lysosomal acid lipase deficiency. The second presentation is a phase 2/3 study in infants with the most rapidly progressive form of the disease, which is typically lethal in the first 6 months of life. And then we have a poster which describes 2-year follow-up data on adults that were put into the first human study with Kanuma, and that's taken through to 2 years of treatment.
The discovery replaced alpha therapy result in a reduction in the multiple disease-related hepatic and lipid abnormalities in children and adults with lysosomal acid replacement.
Assistant Professor of Pathology
at the University of Utah.
I am also
ERUP Laboratories.
Medical Director at ERUP Laboratories, ensure the responsibility for the biochemical genetics lab. Today I would like to discuss a rare and possibly under-recognized cause of liver deficiency is an autosomal recessive disorder characterized by the accumulation of
disorder characterized by the accumulation of cholesterol esters and triglycerides.
disorder characterized by the accumulation of cholesterol esters and triglycerides.